This is Dr. Michael Tapper reporting on behalf of Infectious Disease Advisor from the Infectious Disease Society of America, or IDSA meeting, which is ongoing in New Orleans, Louisiana. I'm joined today by Dr. Holly Frost from the Marshfield Clinic in Wisconsin, and she presented a very interesting paper this morning on the presence of dual infection, the people who are being evaluated for Lyme disease and were also being evaluated at the same time for Powassan virus. So maybe you'll tell us a little bit about your findings.
Yes, so what we did is we looked at residual specimens from patients who were presenting for Lyme disease or suspected Lyme disease. And we did testing to see if they had Lyme, but then also did antibody testing to determine if they had evidence of Powassan virus, and confirmatory testing if there were positive Powassan findings. And what we found was that about 9.5% of patients presenting for suspected tick-borne disease actually had evidence of Powassan-specific antibodies. And for patients who had Lyme disease, 16% of patients had concurrent Powassan virus.
And with these IgM, IgG, could you make any statement about acuteness? Is this background infection or these concurrent infections? Do you have any sense about that?
Yep, so in the tick-borne disease group, we had 6 patients that had just IgM antibodies, 1 with IgM and IgG antibodies, and 2 with IgG antibodies. And then we did do confirmatory PRNT testing, PCR testing, and then also ran flavivirus cross-reactivity testing on these samples to determine if they were probable or confirmed infection.
Another virus out there. I mean, good things travel together with ticks. It's very interesting. We obviously have Powassan virus in our state as well, in New York, but it's not something that we diagnose terribly frequently. So this is very interesting. I think we're going to have to look a lot harder now, based on your data, and look a lot harder, not just for Powassan, but for other dual infections. We know a lot about multiple infections being transmitted by ticks at the same time. So this gives us just another one to worry about in this world of emerging infectious diseases. Thanks so much for your time. It was a fascinating paper.
Thank you.